I'm Ben Irwin. I will be one of your personal physicians for today. We will be exploring recovery from a lower lumbar spinal fracture and lower lumbar muscular injuries. We will be talking about which muscles and joints may have been damaged, how to help those muscles heal, and how those muscles heal.
According to the report, the patient was hit by a cyclist and fell on their back. The patient's spine was fractured at the second lumbar segment, and they're experiencing extreme pain in that area.
We have determined that there are three major muscles that may have been affected by this incident.
First, the rectus abdominis. The rectus abdominis originates in the pubis, inserts in the rib cage, and can be used for flexing the vertebral column.
For each muscle, there are certain actions we recommend you carry out that will make the rehabilitation process more effective. For the rectus abdominis, we recommend that you rest, refrain from working the muscles, gently massage the muscles, and apply cold or hot pads.
A good activity to work the rectus abdominis is crunches. The next possible bone for rehabilitation is the Latissimus Dorsi. It originates in the thoracic and lumbar vertebrae, as well as the coxal bone. It inserts in the proximal end of the humerus, and its function is to extend and adduct the humerus.
For Latissimus dorsi, we suggest you to rest, put ice pack on inflamed area daily, avoid putting excessive pressure. For exercises, we suggest you to do can rows or any form of extension or adduction of the humerus.
The third muscle that we'll be discussing is the external obliques. It originates in the bottom 8 ribs, inserts in the ilium, and its function is to flex the vertebral column and rotate the trunk. For the external obliques, we also suggest to rest. Don't stress the muscle too much. Apply ice to the damaged area for 5 to 10 minutes, 3 to 5 times a day. We would suggest massage therapy for the muscle. Avoid twisting the trunk improperly. We suggest maintaining flexibility in this area. Some exercises you can do are core exercises. For example, a plank to a push-up position, or a plank to a raise arm above the back position. These exercises will help align scar tissue. When scar tissue is aligned, the muscle can take more tension.
So how do all these exercises help improve your muscles? Well, I'm glad you asked.
Your muscles use glucose and ATP to contract, which both require oxygen to be produced. Breathing during exercise increases O2 input and therefore ATP output, and by extension, muscle growth. If no oxygen goes into your muscles, then lactic acid forms instead of the muscles becoming stronger.
For all of the exercises excepting the exercises for the external obliques, isotonic contraction will occur. This means that the muscles shorten as they move, and the number of muscle cells increases. For the external obliques exercises, isometric contraction occurs. This means that the muscles don't necessarily have to move to be exercised. In isometric contractions, the muscles don't shorten and muscle cells enlarge.